and welcoming Dr. Kevin Chan. Kevin is the Medical Director for Children's and Women's Health at Trillium Health Partners and an Associate Professor of Pediatrics at the University of Toronto, as well as a Pediatric Emergency Medicine Doctor at Sick Kids in Toronto. He's the current Chair of the Acute Care Committee of the Canadian Pediatric Society. He's the previous Chair of Pediatrics at Memorial University and Clinical Chief of Children's Health at Eastern Health. He has served as chair of the Canadian Society for International Health, president of Global Health and Emergency Medicine at the Canadian Pediatric Society, an executive member of the section on global health at the American Academy of Pediatrics, and a member of the board of directors for the Consortium of Universities for Global Health. Kevin has worked extensively with UNICEF and the World Bank. He was a Knox Fellow at Harvard University and earned his MPH at the Harvard School of Public Health. His relevant areas of interest here for this talk are in maximizing the well-being of children in disadvantaged populations and addressing climate change as it pertains to children and global health. Kevin and I had the privilege of partnering with Kevin for a piece in Pediatrics, Climate Change and Global Child Health in 2018. And then again this past year in 2019 for a session on climate change and global child health at the Frontiers of Development Symposium hosted by the Royal Academy of Engineering in Cambridge. And it has been a true pleasure to get to work with Kevin over the past couple of years. I'm so happy to have the opportunity for him to speak with you all today on speaking climate change to patients. Thank you so much, Kevin.
Perfect. Good morning, and it's an absolute pleasure to be here. I'd like to thank Becca for inviting me to talk about this. When we first got introduced to the topic, I was going to ask to do my topic, which is usually climate change in children. But I decided to do something a little bit outside my comfort zone. Although the original topic that Becca and I agreed to was speaking climate change to patients, I hope it's okay to expand it a little bit and look at the role of the physician in climate change. I have been looking at this for a while since I introduced a national resolution at the Canadian Medical Association on getting physicians more involved in global climate change. From the micro to the macro, how can we address these issues? And what challenges can we do to get more people involved? It's an issue that I'd like to explore for the next hour. So I have to do the general disclosure, and I have nothing to disclose. And when it comes to some basic topics, there really are some basic learning objectives. So some of these are really, really basic principles. Whoops, sorry. So what I want to talk about today is really a wide range of issues. How to incorporate climate change into medical care, since that was my main theme today. But I want to talk about some basic principles, individual actions and how we can impact climate change, how to incorporate climate change into medical care, greening your hospital, getting involved nationally, changing your community, and getting involved in policy and advocacy, and finally, some discussion about media. So one of the great climate activists is, of course, Greta Thunberg, and this is a famous quote that she says, adults keep saying we owe it to young people to give them hope, but I don't want your hope. I don't want you to be hopeful. I want you to panic. I want you to feel the fear I feel every day. I want you to act. I want you to act as you would in a crisis. I want you to act as if the house is on fire, because it is. As many of you know, climate change is a public health emergency. But like most public health emergencies, without a common cohesiveness and urgency and collective will to act in a coordinated fashion, things can get out of hand. COVID-19 is a prime example. Countries that act in a coordinated, well thought out manner do better than ones that don't. And that's the challenge of global climate change. For us to see that there is a collective urgency to act together, work together to solve the problem. And herein lies the problem. multiple attempts going all the way back from even before the Rio Summit in 1992 to a multitude of conferences, including Kyoto, Copenhagen, Doha, Paris, and so forth. Many promises have been made and many promises have not been kept. We're already 1 degree centigrade or 1.7 degrees Fahrenheit above the 20th century average, and we need to do more. So as I said, these are the learning objectives for today, and we're going to go through a whole bunch of different ideas. And really, when you think about it, there are some very core principles when it comes to talking about climate change. And it's important to have these few key principles. I think the first one really is set a goal and work towards it methodically. Maybe it's something simple about having more information about climate change in your office, or have climate-related information embedded in your discharge instructions. Setting simple goals makes it clear what you're trying to do. I don't think it's possible to believe that you can fix climate change by yourself. Second, I think it's really important to join or even create a community. Often I see people try to tackle climate change on their own. Some of the best moves forward are made in collaboration with others, and climate change is going to need a whole lot of people to change before it's really going to happen. So people often ask me, what can I do as an individual physician? It's not just me, it's a whole bunch of people involved in actually going forward and trying to do different things to make things better. And we'll come back to that in a second. The third thing is think about your audience, especially when you're talking to patients. I think it's really important to consider who you're talking to. If it's a single mom feeding a large family, lecturing on costly organic food may not be the wisest of decisions. Tailoring your messaging is good in general day-to-day relationships. When it's climate change, it's paramount to do it. The fourth thing is make it personal. I think relating to stories on why climate change is important is paramount. For example, when I was chair of pediatrics and chief of children's health, I had the responsibility for the Aboriginal people in Northern Labrador. Climate change was really affecting them. So as ice bridges that used to exist between communities were not there for lengthy periods in the winter, meant it was difficult to connect communities by ice bridges and required transportation either by sea or by air to some of them. It led to weird forms of malnutrition where the general food that used to be available for them was lacking, and they started having a lack of available protein. It led to more isolation and increasing suicide rates. So the suicide rates in Northern Labrador, believe it or not, were about 1 in 5 kids committed suicide before the age of 18. And so we started seeing more and more issues around that. And what we needed to do was address some of these policy concerns, both from the physical health side of things and our mental health, and required us to reevaluate and build more virtual communication with these communities, build alternative transport systems out to these communities. We've seen this also in our cities, increasing allergy seasons and rates, and relating this to climate change is helpful to get people to think about the topic and also to address it in their day-to-day lives. So not an unusual question that I get from parents and from kids. You know, why are the allergy seasons lasting longer? Now relate that to some of the issues around climate change and the warming of our communities. The fifth thing is sometimes our approach to communicating and promoting climate change may not be correct. And sometimes it's important to try different tactics. So I think it's really easy to give up. But what I would argue very much is persist and see what else works from a different sort of communication. And often we don't get the connection right the first time, and we need to try different things to make the connection work. And as Greta Thunberg says, we need to get started now. I think there is no greater public health emergency, even with COVID-19 that is existing right now. I think climate change in the grand scheme of things is the thing that may affect the generation and the actual survival of our planet. So I'd like to talk about a hierarchy of different actions. So there's really different ways we can tackle climate change. And I hope to cover most of these today. I'll focus a little bit more on patient care but I think the other areas are just as important. So there are different areas that you can work in. And so you see a list there, we'll go through that today. So individual actions, I think these are straightforward ones. At a personal level, there's always individual actions that we can take. Although some of these seem relatively straightforward to do, not many of us may focus on it. So there may be things we can do on a personal basis. You know, it's simple things like walk, bike, take local transit instead of driving, driving a low or no carbon vehicle, reducing meat consumption, purchasing local fresh seasonal food, the 3 R's, reduce, reuse, recycle, improving energy efficiency at home and in the office. These are simple things that we can do each on a daily basis. So I have this story, a 12-year-old girl with asthma. She comes into your office. She has a history of asthma. She wants to know what else she can do to help her asthma. So of course you take that opportunity to discuss climate change. If only life was that easy. So as a clinician, I'll be honest, most patients come for a specific medical problem. And in my day job as a pediatrician, I don't talk to patients often straight up about climate change. That's not what they're here in the office for. For the vast majority of patients, they come for a specific medical problem, and they're not interested in climate change. In the evaluation of any public health change, you have to gauge if the person on the other side really wants to change or not. It's true with smoking, it's true with alcohol. The client must be willing to change. On the other side is really you. For many of you as a clinician, there will be a lack of time, there may be general disinterest, there may be a low perceived impact. We're busy people too. Climate change, if I'm going to be honest as a medical practitioner, is about the 15th issue down my list of issues for most patients. But like smoking and alcohol, we have to be ready to act with information when the time is right, and opportunities will arise. So there are things that we can do. We can relate and create links between climate change, the environment, and health in ways that don't undermine the doctor-patient relationship. And I think that's very important to factor in. So why do we even care? We're doctors. If you take the word doctor back to its origin, the Latin root is docere, which means to teach. When a patient comes to see us, we're the second or third most trusted profession after nurses and maybe engineers. On environmental health issues, we're the ones who are listened to the most. And so what we say and how we comment on environmental health and climate change matters. Eric Chivion, who was a founder of the International Physicians for the Prevention of Nuclear War, and a professor of psychiatry and the founding director of the Center for Health and Global Environment at Harvard Medical School, and a hero of mine since I met him over 25 years ago, says it right. So the strength of the physician is that we can translate the abstract into concrete personal terms of human health in everyday language that people could relate to and understand. When talking about nuclear war, Shivian said this: "It's important to talk about skull fractures instead of the number of joules of force in the explosion, about third-degree burns instead of the number of degrees centigrade in the fireball, and about radiation sickness instead of realms of radiation." And so this remains the challenge of the global climate change. How do we relate what the impacts are in real terms to our patients? We'll come back to this theme in a few slides. Dr. Shivian gives an example around cone snails and how they live in tropical coral reefs. They have one of the most potent agents to treat chronic pain, an agent called sakinotide, which is about 1,000 times more potent than morphine with no addictive properties. Losing biodiversity from the warmth of the growing warmth of the world through climate change could mean things that are in our armament to treat no longer exist. So this may be easiest in areas where personal health can be related to climate change. So we all know, and you've probably heard from other lectures, air pollution, asthma, COPD, and its relationship with climate change. Obviously, heat waves and heat-sensitive illnesses. We've talked about severe floods and storms, leading to things like algal blooms or contaminated water. These are all easy things that people can relate to climate change. And I think the last bit is that we can look at things that can improve the environment and our own personal health. So relating things like increased exercise and less automobile use to improve cardiovascular health and reducing obesity are straightforward things. And these are things that are important as physicians to act as health educators. So the first steps are very much this. Improve your knowledge around climate change, environmental health, and individual health. Raising your health literacy is the first step. And I hope this course will hopefully allow you to be more informed about the links. The second step is to look for opportunities to engage. In any good healthcare setting, if you ask questions and leave openings for people to ask, you'll be surprised what patients will engage you with. And I'll come back to that in a second. And the third and final step is simply to lend your voice and engage people in this arena. It may not be easy, but you'll be surprised how many people are interested if you give them the opportunity to discuss it. So these are some of the practical ways that I've looked at really trying to introduce this. I have found in a practical way in my clinics that I often have an opportunity to gauge a patient and a family's interest when I discuss the social history and things that interest children. And if you engage in actually asking in the social history, that it becomes a little bit easier. One of the things that's part of my standardized social history is a phrase that I've added: "Are you concerned about global climate change?" Especially to children. And maybe I'm biased being a pediatrician. Lots of kids actually are very, very interested in discussing global climate change. I also have added questions related to poverty, food security, and housing. And as part of my social determinants of health element in the social history when I meet patients for the first time. And I argue that it really should be part of the standardized questions that we ask. The other thing that's really helpful is in your office or clinics to just have information, posters. When I was chief of the Children's Hospital, I had ads on the television screen. So the educational things in the waiting rooms of the emerge department or in the outpatient clinics, this information was there. And so it sometimes prompts patients and even children to ask questions. And that's a great opportunity to actually engage patients. But at the same time, I want you also to remember that not everyone wants to hear about climate change at every medical visit. I think it's really important to gauge interest and find an appropriate time to discuss climate change while having an appropriate patient-physician relationship. Obviously, I hope you don't discuss climate change when someone's having acute MI. Like, there are times when things are appropriate. However, I think if you can evaluate someone's health and show why it's important for them to engage in climate change, it would be beneficial. For example, maybe getting people interested in more outdoor exercise to improve both cardiovascular health and their own cardiovascular health, and at the same time also that improves the environment. Obviously, some specialities may lend themselves more appropriate to have climate change discussions. Obviously, it's a little bit easier in primary care specialities. But I also think it's also important to be careful not to shame or engage at an inappropriate time. For example, it may not be the best time in the third trimester of a pregnancy to say that there's an environmental hazard that may affect the fetus, or to a financially poor family, as I said before, to ask them to pay for food that they can't afford. I think everything has to be taken in context. And there are a whole bunch of health benefits that can be looked at both in the environmental side of things. So I know Jonathan probably talked about this, looking at things like COPD and asthma, certainly exacerbated by heat and humidity and air pollution. Looking at how we can improve the climate in the air to reduce COPD and asthma risks are important. Certainly things, as was alluded to, environmental allergies, there are more potent pollen, longer allergy seasons that we're starting to see with warming of the world. And these are important issues for us to address. There's also the role of infectious disease in a warming planet. So we're starting to see reemergence of things like malaria starting to show up on the tips of Florida. It will progress north as the climate warms. We're starting to see other new diseases like Zika that are probably climate change related. And so infectious diseases of all sorts are going to become much more prevalent as the world warms again. Certainly, we know about heat waves and heat-sensitive illnesses. Every year, there are issues around that. We've seen vast majority of disasters, probably related to, in some way to global climate change. Everything from hurricanes to tornadoes to wildfires in California or in Canada, in northern Alberta. We've had significant fetal transmission of environmental chemicals and or pollution that are becoming more prevalent as the world warms. And of course, there are significant impacts on food and water insecurity and transportation. As I alluded to with the Labrador story, these impacts are occurring right across the board. And some of the most disadvantaged communities are affected the worst. One of the things I would say is, if you can, there are things that you can incorporate, and you can incorporate climate change into your patient education materials. Everything from disease management plans, discharge materials, medication sheets. If you can find a relationship between personal health and climate change, utilize and help spread information. As I said, some of the infectious diseases that we are starting to see return, like malaria, the spread of Lyme disease, the spread of West Nile, these are all informational things that we incorporate into our patient education materials. We also ensure that climate change impacts are addressed in disease management and care protocols. So in pediatrics, for example, warning parents not to leave their child in a car on a sunny summer day is a straightforward thing that we can do. Making sure that they're drinking lots of fluids while playing sports, ensuring appropriate breaks and rest are important components that mix both climate change and care management. Um, Looking at disaster planning options, for me, to ensure families have a plan and a safety bag and identify where they want to go and what are the safe locations if a disaster occurred. For asthmatics, ensuring that they check the air quality index on a hot or windy day before going outside. And so these are all important things that we can do. And finally, the one thing I would also encourage is we also badly need research to make the links between human disease outcomes and climate change. That literature still needs to be strengthened. The other thing I would say as a healthcare person, in many places, there are things like home environmental assessments that can be done, like including ensuring shade is available, maximizing energy efficiency, etc. So from state to state, there are places that may allow home environmental assessments to occur. The other side of things is there really are community resources for climate resilience that pop up from different states. So there is a low-income home energy assistance program that may exist in your state, and you should check out and see if they exist, especially for our disadvantaged communities. So this is really a table that nicely synopsis part of the thought of how a conversation around climate change can occur. The approach really is twofold. One, condition the patient. So check out the knowledge and personal beliefs. See if you can get a health issue that is relevant to climate change. I think the second is conditioning the physician. And so right now we're working on the education and training links between climate change, environment, and health, and how you can counsel patients related to climate change and environmental health. Developing patient materials and tools available to patients. And then, as we said, build up the knowledge and skills and also ensure that the personal beliefs are there. The other components we also have to factor into account include speciality is relevant to climate change environment and looking at time pressures, which are a constant issue for physicians. And this gives you a way where the physician and patient can really talk about climate change and our environmental health. And really gauging these different components are there. My thoughts are there are also other opportunities to engage patients that may not occur in a direct patient to physician relationship. So many times I may give talks on medical and non-medical related topics. Becca knows I'm heavily involved in gun control legislation in Canada. And right now I'm heavily involved in pediatric COVID-19 standards nationally. Climate change is a topic I've had conversations with my patients and the general public around, with people who are for it and some who are very against. And that has a very different lens and focus. But the opportunity to communicate around the topic outside the direct patient-physician relationship exists. And we'll get to that in a second. So I'm going to just go on to an issue around greening your hospital. So I think one of the areas where we also can have a major impact is actually in the facilities that we work in. And I think Cleveland Clinics had a fascinating program. About 8 years ago, they started a $500,000 fund to look into greening their hospital. And one of their caveats was any savings that was made was pumped back into green initiatives. So now there's actually about a $7.5 million per year green revolving fund. Some of the things that they did included simple things. And so one of the things that they did was changing light bulbs from fluorescent lights to lower energy LEDs. It not only improved the quality of light inside the hospital, it saved the hospital about $2.5 million per year. Another simple thing that they did was in hospital computers, just making sure that the computers went to sleep after 15 minutes of non-use. And that decreased the energy consumption by about $400,000 per year. The third thing that they highlighted was ORs and air exchanges. And ORs need to be, and the air exchange on a fairly rapid basis, about 20, 30 times per hour. And they stopped doing it while the ORs weren't in use. And that saved, believe it or not, about $2 million per year. And so there are simple things that you can do within your institutions that may make a massive difference. Kaiser Permanente, for example, built solar panels and LEDs at their new San Diego facility, and that saved about $2 million a year. And stuff like planning for disasters. Following the Hurricane Sandy flooding the New York University Langone Medical Center, partners in Boston, when they were building their new rehab hospital, actually rethought and built their hospital 2.5 feet above the highest flood line. So they propped the hospital up. And they also used very heavy insulation and large windows for daylight. The additional cost was about 1.5% of the total cost of the building, but they recouped the cost within about 5 years through reduced energy requirements. And so simple things can make a difference. I think also if we can minimize landfill and incineration use for waste disposal, that will help green supplies. And as I said before, getting local supplies. So one of the biggest purchasers of food in any ecosystem is actually hospitals. And if we could use more local supplies, and if there's one thing I've learned actually from COVID-19, is that our supply chains may benefit actually from having locally sourced places, including food. And that can make an enormous green difference. I'm just going to briefly say, the one thing I will say is find organizations that champion this cause. It's much easier when you're part of a group than doing it alone. I've worked with the American Academy of Pediatrics, the Canadian Pediatric Society, and my National Medical Association, which is Canadian Medical Association, to forward climate change policies. In fact, climate change is one of the 5 major strategic themes of the Canadian Medical Association. And I think we've been probably the strongest lobby to make a more environmental friendly Canadian policy. I think we were probably advocates for the Canadian carbon tax that went federally, but we still have a far ways to go. I think lending your voice to a collective cause has significant value. One of the joys I've had as head of Children's Health for a province is the ability to engage entire communities. I've had the opportunity to integrate public health messages into schools, in meetings, and even in public debate forums. Some of my competition, so to speak, have been CEOs of oil companies who have also funded generously my children's hospital, which leads to interesting conflict of interests. But I believe people should be provided facts and for them to make decisions. When I was in Toronto, one of my closest friends championed bike pathways and bike lanes. And Toronto is a much more friendly place to get around than it was 20 years ago. The entire city is connected by bike pathways, which is cool and exciting for many people who want to exercise. Some things aren't controversial, such as reducing waste, using less energy, making more green urban space usable. Community gardens work great in urban areas. Some are highly controversial. For example, London, England had a congestion charge, which was meant to minimize cars in the core of London, but also to encourage public transport as an alternative because it's much less costly. Or Portland, Oregon's famed walkability in the center of the city. When it was first introduced, it was highly controversial, but nowadays is accepted as norms. So I do think it is possible to change your community. Another way to get involved is through policy and advocacy. Many places have now set up disaster plans post-Katrina in the wildfires in California. We set up policies for climate mitigation, including at the hospital level to ensure environmental sustainability. From a social justice perspective, I think it's important for us to continue to advocate for the most disadvantaged. We have great evidence that the most disadvantaged will suffer more, and even worse in poorer countries, who may be challenged around mitigation and adaptation. 30 years ago, I presented at a global health conference that I felt global climate change would be one of the biggest challenges in the next 25 years. I was entirely right. And all the work that I've done to help people in Africa, where I've watched literally under 5 mortality fall, 90% is all for naught if global climate change goes up 3 to 4 degrees centigrade. The water stress, the conflicts that will occur around food availability will be so acute that climate change affects the very poorest of the world. I look at Canada and go, we're going to get warmer. Yay. But for my friends in sub-Saharan Africa, the number of days above 40 degrees centigrade may climb to about above 30 per year. And with that, infectious disease and increased malnutrition will return. We need more voices to say that this isn't right. I would say we can do this at various levels, working at the local, state, and federal legislatures to make a difference. We can work in promoting climate change policy, housing, transport, water, and agriculture. And for those of you who are keen in advocacy, participating in a legislative brief on climate change and health or advocating at the various political levels may affect change. Some of the most effective climate change policies, actually, even without federal leadership, occurs really at the local levels. It may occur at your local mayor's level, can occur at your governor's level, and we can see actions occur even in the absence of federal policy. Federal inaction does not preclude that we can't make changes at the local level that have actually more impact. Finally, one of the roles I never thought I'd get into, and I've gotten into more as I've aged and gotten less wiser, is the media. I write op-eds all the time on a variety of topics. Climate change is one that certainly needs more voices. One of the funniest things I've heard recently was a politician complaining that what was being done was political opportunity. Opportunity arises when bad things occur, and sometimes it's important to change that narrative on a topic and push through when the opportunities arise. I have to say it's a little easier in Canada than the United States, but there are times when bad things occur that we have the opportunity to make the changes and to push change forward. If you have the willingness to do so, speak locally, nationally, or on social media about these issues. Our collective voice is what makes change possible. So this is what I talked about today, the basic principles, some individual actions on what we can do, how to incorporate climate change into medical care, greening of the hospital, getting involved nationally, changing your community, getting involved in policy and advocacy, and advocating through media. I hope that gives you a sense of what you guys can do. I think this quote by Albert Einstein will also say what I think. The world will not be destroyed by those who do evil, but by those who watch them without doing anything. Thank you very much for your time, and I'm looking forward to your questions.
Kevin, thank you so much for that talk and for those words. And I think what's striking about everything you said is that it's not just a theoretical framework for the students, but you are doing all of those actions, from taking care of patients to advocating at the local level through the national level, and you are so heavily involved in all of it. How do you find the time? Do you have advice for students who want to balance clinical care with public health and advocacy? Any suggestions?
Well, first off, I will say that doing clinical care helps inform public health policy. So I think people who aren't doing clinical care miss out on what the front line is actually thinking and doing. And I think that's valuable. I think when it comes to really being effective in advocacy, it's never just about what you do as an individual. Um, I have to say, one of the things is I'm very focused, and behind me you'll see a list of things to that are focused in what I want to do over a certain time frame. And so time management is an important component. But the second thing I would say, especially when it comes to advocacy at the highest levels, it's never just about you. It's really trying to attract other people to be interested and energized to move things forward. And so I think the real key is to get more people involved. So I used to do in another career a lot of global health, and mostly in sub-Saharan Africa. Nowadays, I have whole teams that go out and do things, and I think that's where the advantage lies, is to join a collective thought process to move ideas forward. And it's through that collective process that things will actually change.
Thank you so much, Kevin. This question is from Emmeline Laney at Emory, and it came partly in response to me asking students, what are some challenges in speaking to climate skeptics that you've encountered, and what can we ask our experts through this course about engaging with them? And you touched on this briefly when you said perhaps the job is a little bit easier in Canada than in the United States in terms of just belief in science, belief in scientific facts. And I wonder if you guys are encountering the same resistance to facts on everything from vaccine to climate change that we sometimes feel here. But Emmeline's question is that climate skeptics oftentimes are not only skeptic of climate change and the science of climate change, but really of science itself, the process of fact production altogether. This manifests in a range of other categories, from COVID-19 deniers, anti-vaxxers, anti-government. Can you comment on ways to better involve the community, specifically skeptics, in fact production for climate science that may engender a greater level of trust? I'm wondering if your work in Labrador, how you've involved the community there in confronting climate change, if you did confront that skepticism.
The second part of the question is much easier. I think in northern Labrador, there were no skeptics. They were seeing the climate changing right in front of them. So they really had zero issue around the fact that the climate was changing. They told me that it's been changing for probably around 20 years. They saw small bits, and it's accelerated over probably the past 5 to 7 years. But they have no doubt that the climate is changing, because they're seeing it on a daily basis. The question around climate skeptics, and also the faction that is against science as a whole, the there is ways to that you can engage people, but there are people that are unengageable. And I think there is a reality that some unfortunately the discourse in the world as a whole has become much more fractionalized. I don't know if it's partially a gauge of the social media separation of ideas, but there are people who are unwilling to listen to any ideas whatsoever. I don't think, just like it is for a patient, you have to gauge when you can engage or not engage. There are people, though, that are willing to engage in constructive feedback side of things. So I've had public health debates with actual CEOs of oil companies, and who are financing the provincial budget, to be honest. Um, but you look at agreed upon uh, degree of what their issues, how they view it, and take a look at some of their facts. You provide your facts. If you can have constructive engagement, there is a possibility to have actually constructive movement forward. But I don't know how you engage if people really don't want to engage. I don't have a simple answer to that, because to me, um, the problem is if you can't get the other side to even take a break and stop yelling, to actually listen for a second, it's really hard to have that engagement piece. I don't have a solution to that. If someone does, I'd love to hear it.
Thank you, Kevin. I think that's one we're all still trying to sort out. I have a question from Ben here at Emory, and he's asking for trainees, for our students and residents. How do you recommend broaching climate change with a wards or surgery team when they go back to clinical rotations when discussing patient care? How can students nudge the higher ups to talk more about environmental health when it is relevant?
Um, I think it's important to voice your opinions on the wards. So if it is relevant, one of the keys is for most clinicians, if you can somehow frame it as a co-benefit on a health perspective, I think everyone wants to improve the patient experience and care. And if you can somehow nudge it into terms that is patient-centric and patient beneficial, I think most people are receptive to that from a clinician experience. So when I run wards with my medical students and residents, I don't just want to know about the patient's medical facts. I also want to understand their context in which they live. And part of that is nudging and training clinicians to be interested beyond the medical facts to the whole of the person. I think part of it is also educating faculty to be receptive to looking beyond medical issues, to looking to the social history side of things, to see if there are other factors that need to be taken into account. And one of the other aspects that we have embedded when I was certainly chair out in Newfoundland was we embedded some of the social determinants of health into our multidisciplinary teams. So it may not be resident medical student necessarily finding out all of the social history aspects, but we often had a social worker and other members of the team go in and talk to families about not only their medical aspects, but also their social aspects. And so if we could build better multidisciplinary teams that factor these things into account, I think that's a way we can bring this out in daily rounds.
It's a great model. Kind of related to that question from Allison at Emory. She's wondering, when you ask your question, if you're concerned about climate change or global warming, how do you transition that to the next step if the patient says yes? If they say no, what would your follow-up be?
Um, I think really the yes question is easy. I think then we can have a straightforward conversation. It doesn't have to be at the first visit. It could be on multiple occasions, coming back and forth, and asking them really what elements interest them, get, get, getting them to express themselves. I find it valuable, and I'm biased because I'm a pediatrician, that kids often have different aspects that they're very interested in, and asking them to write the questions or communicate is an opportunity. But one of the things that we have luckily in our records is information on the social history side of things that flag up different interests or different things that need to be addressed. Um, and we often have this as things to address at some point in time. So it doesn't have to be done necessarily at the first visit. It could be done at the fourth visit. But these are things that are of interest that sometimes, for me, children want to chat about. How we do it if they say no is that's where the informational management side of things, where you provide various passive cues. So they could be posters, they could be, as I said, television screens with uh, advertisements on them on climate change. Sometimes prompts them to discuss the issue, and sometimes it doesn't. So um, I've been thinking partly in Canada. I don't know if you have in the United States. We have a checklist of various things that you should do at each visit. And there's a pretty standardized checklist for the family docs who see most of our primary care. And I'd like to put global climate change onto that checklist. Food insecurity is, housing is, many of the social determinants of health already are on it. So I'd like to see if I can put global climate change onto that list.
Yeah, I think that's a great idea. We've talked a lot in our small groups about environmental determinants of health, and we teach social determinants, but how we integrate those environmental determinants of health, like climate change, into patient encounters. And we'll be talking more about that later this week too.
Yeah.
I think it's interesting approaching children directly, and I do that as well. I've had instances where 7-year-olds convince their parents that flu shot is safe and they want to get it, where the parents were reluctant. But when you ask the child, they say, yes, I want it. My teacher says I should get it. And it gives them a chance to use their voice and experience and start to being their own advocates as well. And I like that approach of asking the kids about climate change too. You were just mentioning the posters and TV materials. I have a question from Claire at Emory. She says, having information available in the clinic settings, like those posters, TV, ads, screensavers, sounds wonderful. And she's wondering if you know of sources for this material or collaborations with public health departments to expand these materials more broadly as a campaign across the city to raise awareness.
Um, so there are a few places that have some great information. I'm Canadian biased, so that um, Canada probably has a little bit more information in this arena. Um, so we have a Canadian Physicians for the Environment. They have a very good informational package. I don't know if there's an equivalent in the United States, unfortunately. But the person who heads that association is a Canadian Medical Association board member, so it's disseminated quite widely. And so it was designed through the Canadian Associations for Physicians and the Environment. but it's disseminated through the Canadian Medical Association. So that, I don't know, I honestly don't know the US system well enough to know if anything exists to that equivalent.
It sounds like we should look up what you guys have as well. And I know the Med Society Consortium on Climate and Health has a lot of great resources. I'm not familiar with like a waiting room, short video type thing. I think that would be a great idea. So maybe we can make one. And a lot of the materials, like you said, need to be adapted to the local context, to what's most relevant locally.
Yeah.
So there is work to be done there, and making sure that clinicians have these materials accessible, because we shouldn't expect everyone to be creating them, but we can help in making them available.
Yeah.
A question from Mount Sinai. The student says, thank you so much for that lecture, Dr. Chan. How do you think compensation models for healthcare systems and physicians can be changed to incentivize addressing climate change effects for marginalized communities that are disproportionately impacted by their changing environmental conditions? Like any thoughts on changing compensation models for healthcare systems?
Well, it depends on, this is a really complicated issue. Um, the the best way, honestly, if you had an option, is to have a salary system or equivalent type of program. So in Canada, in the academic centers, or even in non-academic centers, there are what we call alternative payment plans, or equivalent to those, where a portion of your salary is dedicated to non-clinical related activities. So Canada is very different than the United States in that fashion. So having worked in Boston, I kind of know the US system. And I'll say the one thing that is nice about the Canadian system is there is usually a portion of your time where the where a portion of your time is spent to non-clinical related activities, and that would be ideal to move things forward. But I don't know if that's really possible. It really depends on your specific healthcare system. One of the challenges in the US and in all healthcare systems, as a matter of fact, is clinical service drives the dollars, and that's the reality. But building these other components in actually leads to better physician satisfaction, and actually improves and moves the bar forward. And so the way it's done in the US for research is NIH funds
Just a sec.
fund salary components, but there is no equivalent for the education and health advocacy side of things. And building a stream like that, I think, would be enormously beneficial in the long run. In Canada, our system is paid through a single payer system, so we can have much more flexibility in ensuring that people do that component. So I don't know, I would argue a single payer system would be ideal for you guys, but I'm not sure that's happening anytime soon. But finding that funding stream for this advocacy component is actually important.
Thank you, Kevin. And I think you've highlighted so many different ways that we can serve as advocates at different levels for our institution, and those kind of low-hanging fruits, that energy savings that are for greener buildings, along with advocating for systemic change as we go along too.
Yeah.
I think we're out of time now. If you guys will all join me in thanking Dr. Chan